Okay. In the beginning, hello everyone, or good afternoon, as it is here in Finland at the moment, where we come from. My name is Kristiina Kariniemi-Örmälä, and me and my colleagues are here to tell you from our lean transformation in our social and healthcare organization. We are very happy for this opportunity. And I'm the Kristiina, leader of integration of our organization, and also I'm the leader of the lean project of our organization. And here with me are
Petra Hurme. I'm account manager and a project manager of the lean project and also a lean coach. And then there is Päivi.
Hello, my name is Päivi Mäkelä-Benks and I am service manager in Keusote.
And here's a few words about our social and healthcare organization. As I said, we come from Finland, living our area is near Helsinki, our capital, and we are quite a new organization. We have started, organized, and provide health and social services for our member municipalities in the beginning of January 2019. There lives a little over 200,000 people, citizens in our area, and in our organization we have approximately 3,500 employees. Our target is to emphasize services located nearby and with a low threshold provided in a customer-oriented and efficient manner for the residents of the area. We think that this way health and social services are sized and appropriate. It could be said that our lean transformation is based on two principles. The one is setting goals and of course measuring those, and the other one is offering lean learning possibilities for everyone working in our organization. Here you can see the goals we have set for our organization, and as I said, we are quite young organization, so we had a possibility to start as lean as possible, or as setting goals for our lean transformation from the very beginning of our work together. And we have set these goals for each year and for the whole organization. And every year we have set the new goals based on how we have reached the last year's goals or how we have succeeded. And on the other hand, based the needed improvements. And this year our goals are daily management tables are used in 100 units, which means all our units. And daily management routine is standardized and implemented in 80% of the units, and 50 customer-oriented operational improvements ideas have been implemented and for 8 trees. And you can put the next slide, please. And here you can see the concepts, learning concept we have offered to our employees during this our journey, and we have 4 different kind of learning concepts at the moment. The one is for this lean transformation for managers and leaders, and second is smooth processes coaching for work groups, and this lean basics open to all is 3 to 4 hours learning sessions working together in the themes like what is lean or daily management or learning A3, and they are open for all our employees, and they can choose the suitable for them in an individual level. And the third, this customized services is I think it's the most important coaching concept we are having at the moment, and maybe in the near future too, because this is customized for our working groups or working teams and units individual needs, based on the individual needs in working more in a way, lean ways, and this is the way I think we are going ahead, going towards, or this is the most important way of learning lean in our organization at the moment. And I think, Petra, it's your turn.
Yes, I will tell some topics of the results. And first, the daily management boards. This is one of our main goals. We have had it for 3 years. And as we can see, when you set high goals, we don't always reach them right away. But the most important thing here is that year by year we are closer to the goal. So there is, we can say that there is an upswing. And the A3s, there was this goal about the A3s, and this goal we set this year. And it's been a difficult year for us, for all of us, because of the pandemic. And we are super proud that we have reached this situation. 19 customer-oriented improvements implemented and recorded for A3. Actually, this should be 20 A3s. I heard it this morning, and I just couldn't put it here anymore. But by using A3s to solve problems and raise standards, we can minimize waste, solve real problems, and reach high goals by using facts. And we have standardized our daily management model, as Christina also already said. And this year we started to audit daily managing in our organization. And we have found out that the most significant shortcoming is the lack of SMART goal. Or sometimes there are too many goals at the same time. We also found that teams has difficulties to find relevant meters. And of course, after all these auditations, we coach the teams and we help them to go to the next level and coach them to solve the problems they have at the time. So in the future, they can use that standardized daily management model we have set in our organization. And we have collected NPS, Net Promoter Score, of our services, lean services, coaching services for 3 years. And the goal has been 80. We are not there yet, but I think we are at the good level. NPS is now 62. It has been a bit difficult to develop these lean services because we have received very little negative feedback or development ideas. Here are the main things we have reached, and next we can tell something about the future. It is important to us to improve daily management in the future. So I think it's going to be one of our main goals in the future. as I said earlier, the teams don't have goals at all sometimes, or they have too many goals. So when you have too many goals, it's hard to reach them. So we have to focus on the goals and make sure that all teams have clear goals and not too many goals. And the other thing is that we want to increase employee and customer satisfaction data. By increasing employee and customer participation. And by these two things, we think that there are more opportunities for teams and customers to influence, which is one of our most important strategic goals at the moment and in the future also. So the outcomes are we learn problem solving, continuous improving, and self-improvement.
And I'd like to add that this opportunity for teams, our workers and customers to influence, to raise that is very important, because at the moment and in the future, it seems that in the future we have lack of professionals, and we like to guarantee that we are going to have professionals in the future too in our organization. And we think that this continuous improving and this self-improvement possibilities we are offering for our people is one important way to keep and these marvelous professionals in our organization in future. So it's like a win-win situation for all.
Yes, and I'm sure you want to hear a case from Keusote, and here it is, Päivi Mäkelä-Bengs.
Thank you, and thank you to the opportunities to come here and present our case. And I have to say that the work is still going on during this area, which we started at 3 years ago, a little bit before the Keusote actually came to us. And I'm responsible for the health or general practice and nurse services in Keusote. And we have had and have still the problem which is universal of the health station or health services in Finland. And the problem we started to resolve was that the patient either contacted the health station through different phone numbers, reaching randomly selected nurses, arrived at the premises. And for this client, the problem was it shows to them that we had a poor availability of services and fragmentation of care. At the same time, the care was delayed and the clients were very satisfied, and our personnel were very overcrowded. And the case or the problem solving started with many gatekeepers only when the patient reached doctor appointments. And then we divided our clients or patients in two different queue, urgent and non-urgent. And we even tell to our clients that your service need, it's not urgent. And for this work, we set 3 different goals. And the one first they had was that the treatment queue will be eliminated, that people doesn't get help in waiting for queue for service. And at the same time, we saw that the continuity of care is most important things in general practice services. So we wanted to improve that. And at the same time, we decided that the client's matter is commenced immediately or within 2 hours when she or he has contacted us. And we moved this, or we removed that the client will be jumping to the different personnel or different units without any value or without any help. For this third goal of our work was that the waiting time for non-urgent appointments will be at the health station's doctor less than 3 days. And that included that we removed also the division patients need in urgent or non-urgent services. This picture here, it doesn't, I imagine you cannot see it very well, but it tells us how many gatekeepers or this kind of things there was or loss there was before our client or patient get helped or we make any value for them. And after that, we make the root analysis according to the lean principles, and this, which I say that no one take it the response for the care. So we have this kind of skip dots working, or which I can call also it's more than loss in Leon terms, is disturbed demands which we are making in our working. So we put the patient just on the other queue to the next queue. And the charge of the client case was missing. In process, we recognize that we have that there must be other ways to solve client's matter than only the doctor's appointment or rejection or placing the client in the queue. The material problem we found that, or root cause, we found that there was no client-orientated segmentation, and we think that we have to make this kind of client-based segmentation in which we have the services. At the same time, our management was narrow and uninformed hierarchy, and immediately the leadership was missing, and the measurement of the tools of daily management was missing, or we didn't have any of them. So we make the PDCA. Petra, can you put the next slide, please? This one, thank you. I'm sorry, I forgot to say to you. So for this, and we make the PDC description for that every patient is getting contact person in the health station. We are going to doing the multi-professional teamwork. We are taking the remote practice services, and at the same time proactive approach. We have this kind of theme that the client just contact us once, and when it's getting to in our services, so afterwards we are contacting the customs. And for the teamwork modeling and remote practice, we need this daily management, as well as measurement indicators and record keeping. So we started to reducing loss and these disturbed demands. And first, what we find was that the appointment operation just took a lot of research, of nurse research, without any value for the customer patient. So we finished that works, and we designed that contact person whom the custom can contact regardless of the subject. In any case, he has a known nurse which they are contacting. At the same time, as I mentioned, we finished the division in the urgent and non-urgent activities. And we make these remote services enable handling the customs issue immediately and in the multi-professional manner. And we take this proactive approach to work and taking personal responsibility or team responsibility for the customs who belongs to the team. And we take this, that we take care more of our customs, that we make an understanding about what is customs' own goal, and we are supporting the customs in their own health goals to receive them. Then I have few slides here for our results. T-Dream is the third available time for the doctor or nurse. And when we started, this in different health station at 1 year ago or 2 years ago, here we can see it was over 30 days. And nowadays in different station in Keusote, we have the third available time to the doctor under 1 week or 10 days. And the same happened quite sudden at the same time for the nurse time, that you can get appointment to the nurse at the same time. And the next slide, I have this development of our daily management tables or boards, as Petra and Christina call them. Here in the left side of the picture, you can see our first daily management table, which was in my room in Hyrylä. And now then we get these sophisticated Excel tables. Here we can see the number of contact person in relation of the population. And nowadays we use also our PowerPoint data to see what in which states our function is to the when you are looking for our organization strategies goals. And here is the 1 meter for that. Here can we see the number of the customs and their contacts. So thank you very much your time. Are we ready to answer any question, if there is any question?
Or any comments? If you don't have any questions, we would like to hear comments if you have ones. There are some comments in the chat. Thank you. Okay, if there are no questions or more comments, I think we are going to say thank you. It was good to be here.
Thank you. Have a nice day.
Thank
Bye-bye.
you. Bye.